Regarding biopsy, there are different ways to take biopsy. First of all is fine needle aspirator cytology. This is not enough in bone biopsy. Other way around is true cut needle biopsy for soft tissue and Jamshidi needle used for bone biopsy. And open biopsy is also one of a indication, one of the way. So the true cut biopsy or Jamshidi needle used in the bone, open biopsy. There are certain important things to be taken care of while doing a biopsy. First of all, the biopsy must be performed uh, by the surgeon or specialist bone tumor unit itself. The tract should be removed at the complete remove resection of the tumor. Therefore, proper positioning of the incision is important. Extensile longitudinal incision are used. Transverse incisions are not utilized. If using local anesthesia, then judicious use of it is indicated to avoid seeding. Tourniquet must not be accentuated. Only gravity accentuation is indicated. Uh, the incision should not contaminate more than one compartment. Enough soft tissue should be taken to avoid area of central necrosis. So mostly the biopsy is going towards the periphery of the tumor. Meticulous hemostasis should be achieved. The bone biopsy should be sent in a formalin container. If the drain is inserted, it should come out from the site of incision. Uh, Always remember to send a specimen for culture, and all these sutures, once suture is done, it should be in such a way to avoid further excisions later on. These all are advices by the Mencken JBJS 1996.